cerebral circulation. Just cradling the head with some gentle traction. Just gently resting your hand on Nabi Marma. Here, just going to go through some of the movements. Palm to palm is nice with the hand-foot cross current. And here you can just place your thumbs gently on Tal Hridaya at the center of the soles of the feet. And your hands can just come around, or you can hold just gently. So Marshall has felt that the marmas of the chest yesterday felt good. So right here, I'm going to start working a little bit into the marmas of the chest and remember the Apastamba Marma into the second intercostal space, just lateral of the sternum. You know, the Udana Vayu originates down, its location is from the diaphragm upward, right, into the neck. So here I'm going, and I know Marshall has eaten, so I'm going to be very light here, but I'm just going to have you take a deep breath in, Marshall. And then I'm just going to take the edge of my hand and just give a little pressure from the Vankari Marma up in the solar plexus area and just gently go downward to the Yakrit Marma, which is the liver point. Okay, so again, inhale and exhale. And I'm just taking the edge of my hand and going underneath the rib cage a little, just freeing the diaphragm. Good. And then on the other side, just taking my hand here, inhale, and then as he exhales, just going under. Okay, this is just a little freeing. You can go quite a bit deeper than this, but he's eaten breakfast, so here I'm not going to interfere too much with his digestion, but does that feel okay? Mm-hmm. His face is comfortable, relaxed. So here I'm going to just take my hand right under the neck and right here at the diaphragm. 2 strong points of Udana Vayu. And just feel in the inhale and the exhale. And as he exhales, I'm just going to move up a little bit. Udana governs exhalation, inhaling. And as he exhales, I'm going to move up again. Here I'm just going to turn my hand so my hand doesn't touch the nipples. And then my middle finger just rests right in that sternoclavicular notch, which is a strong point of Udana Vayu. We didn't discuss yesterday, but the Kantha Marma, or the Marma of the throat. Good. But we don't need to worry about that point. We just want to come up with each exhalation, just having an intention. So here I'm just going to do some light, energetic strokes, which just help to guide that Udana energy. Yesterday it spoke about holding the hands on either side of the head. You can even hold the hands slightly over the ears, depending upon your hand size and their body size. The middle fingers can come right down into the Amsa Marma. The Amsa Marma that is at the base of the neck where the neck meets the shoulders. And you want your fingers to come right down deep enough to where you can just give a gentle rock and you feel the chest move side to side. It's a nice way to work Amsa. This is a very nice point for emotions that tend to lodge within the lungs or even the pericardium. You can also just take your hands around the neck a little bit like this and get your thumb as a base, support, and find that soft spot in the Amsa where you can really get down in. It's not deep pressure on the Marma, but you have to get through a certain amount of tissue, which requires some pressure. I'll come up over the shirt here so you can see. How's that feel? Okay? And I like to just take my thumbs, give some gentle pressure going outward to the lateral Amsa. So coming out with the thumbs, all the way along the upper trapezius, all the way out to where your palms can just press on that outer Amsa. And we don't have to worry about pinpoint pressure here. We're just going to massage our palms around the acromion process. And then take our thumbs to the midpoint of the scapula, of the trapezius, and press on the Skanda Marma. Remember the son of Shiva, Skanda, where the point where the bow rests, right here at the midpoint of the trap. Now that I've worked that energy down a little bit, those points really settle prana. And just give a little traction to the neck. If I just hold the head in my hands, I'm going to press the Skanda Marma again a little bit. So I talked about working on the proximal points and distal points, so I'm going to work a point here that can help with the lungs as well as the large intestine, which are paired organs in Ayurveda. just to help that respiratory energy a little more. Just his bala is strong, so his strength is good. I'm going to just take my thumb into the Tal Hridaya and just work right on the Hridaya Marma, right here in the center of the chest, right there in this midpoint. Is that tender in there? Oftentimes, this marma can just be rocked with the palm pressure. Indrabasta marma, just the two anguli marma right below the fold, the crease of the elbow. And the Kshipra Marma, which is also known as Angushtamula, the webbing of the thumb and forefinger. It's nice after a little session like this to just give a little traction, pushing and opening, that energy flow. Adipati, the top of the head. Just place the palm there. I'm going to keep my palm over the heart. That sadhaka, with the heart-mind connection. How do you feel?
Good.
Good.